So, I am Alexa Therese B. Bihok, a BSN 3 student. So, for today's video, I'll be responding to the given situation according to the scenario. So, the scenario is, you are assigned as a medication nurse in Ward ABC. Immediately upon assuming possession, you encounter the following scenarios. So, first scenario is, a depressed client is given phenylzine Nardel, an antidepressant MAO inhibitor. Then, the significant other visits the client and asks you if the client may be able to feed on avocado banana salad. What would your response be? So, I would advise not to eat avocado banana salad while taking phenylzine. Why? Because avocados, especially overripe, are high in thiamine, which can interact with MAO inhibitor and can cause a dangerous increase in a blood pressure. Basically, bananas are generally safer when ripe, but overripe bananas should also be avoided. For the second scenario, an anxious client has a due diazepam volume. An anxiolytic was found to have an RR of 10 breaths per minute prior to administering the medication. What is your nursing responsibility in this case? So, I will withhold the medication, assess the client for further assessment, monitor vital signs, and notify the physician immediately. For the third one, a newly admitted manic client is prescribed lithium as part of the treatment regimen. Ask you what it is for. What would your response be? My response is, lithium is a mood stabilizer that helps control the symptoms of mania, such as excessive energy, rapid thoughts, impulsive behavior, and mood swings. It also helps prevent future manic and depressive episodes. Fourth one, upon endorsement or nursing shift handover, the same client in number 3 is reported to have a urine output of less than 100 cc. What does this indicate? So, this may indicate decreased kidney function or dehydration, which can cause lithium to accumulate in the body and increase the risk of lithium toxicity. For the fifth, after 2 hours, the same client manifested nausea, vomiting, diarrhea, and abdominal cramps. What do this indicate for a client on lithium therapy? So, these are the early signs of lithium toxicity. I would hold the medication, assess the client, and notify the physician immediately. For the sixth, what type of agents or drugs prevent pseudoparkinsonism? So, it should be anticholinergic agents such as benztropine or trihexyphenidyl are used to prevent or treat pseudoparkinsonism. For the seventh, your client taking alprazolam Xanax states that, I don't like medicines a lot because they have this addictive effect. Good thing my medication doesn't. How would you respond to this statement? So, I would say, I understand your concern. However, alprazolam can be habit-forming, especially if taken for a long time or at high doses. It is important to take it exactly as prescribed and never stop it suddenly. Next is the 8th one. You have a client who has schizophrenia and you noted that facial grimaces, tongue thrusting, and you even heard a smacking sound. Based on these findings, it is most likely that your client is experiencing what condition or disorder? So these findings suggest tardive dyskinesia. It is a late onset extrapyramidal side effect caused by prolonged use of antipsychotic medications. Next is, you are teaching the client about antidepressant drug fluoxetine Prozac. Your client asked us to how long would the full therapeutic effects may be seen. What would your response be? So, the full therapeutic effect is usually seen after 4 to 6 weeks. Although, some people may notice improvement sooner. Last scenario. Your client who is taking fluphenazine prolixin has a sore throat and fever accompanied by muscle rigidity. Based on these findings, it is most likely that your client is manifesting what syndrome? These symptoms may indicate neuroleptic malignant syndrome or NMS. It is a life-threatening reaction to antipsychotic medications. The medication should be stopped and the physician should be notified immediately. That's all.